The Economic Recovery Corps is for communities and places to build capacity and drive economic opportunity. It's a 2.5-year fellowship that is really focused on the communities themselves and the long-term approach to building capacity in these places.
In 2024, the International Economic Development Council launched the inaugural Economic Recovery Corps Fellowship Program. Through this process, we've placed 65 fellows in 65 locations across the U.S., territories, and tribal nations. We're in this because we want to ensure that no community gets left behind and that all Americans can participate in a new era of prosperity.
Since the 1960s, especially in the Central Appalachian region, which is really the core of Eastern Kentucky, we've been distressed, chronically distressed for decades. Even when the economy was better, when more coal was being produced and the extraction industries of natural gas and timber were going well, our counties were still red. I guess the challenge is, where do you start? There's so many places to start, but you have to start somewhere and start something to get to the destination that we want, which is really a job for every Eastern Kentuckian that wants to work.
It's nothing unique to Eastern Kentucky, but I do think there's something compelling about the mountains in Appalachia. We really feel like that we have the right ideas, we have some of the right solutions or the right plans, but like anything, personnel is always the most important piece. When we saw the ERC program and the idea of 30 months of a mid-career professional paid for with the support that IEDC and their partners offered, it was a no-brainer.
They actually had a matching process where we had to interview with host communities. And when I saw the SOAR name as one of the three, I mean, my jaw dropped. It was just super exciting to know that the possibility of coming back home to do the type of work that I'm passionate about, to do the type of work that I want to do, I mean, it couldn't be any more perfect.
But when we found out we were matched with Will, who was our top candidate, it was like, well, I'm ready to get going today. That's the exact type of guy we need in our organization, the guy that's just pedal to the metal, foot on the gas. We're gonna make the most out of those 30 months.
But when I started, as like most fellows, my project kind of changed. Consider my background and my expertise, I was thrown right in to help mold and shape this grant writing process and this proposal for EDA. And the whole point of the ERC Fellowship is really to build capacity in underserved areas. And I felt like that's exactly what I did. Fast forward to today, we actually won first place. We were awarded $40 million for the Recompete grant, which will be not only transformational for the region, but transformational for SOAR as an organization.
The U.S. Economic Development Administration grant is focused on providing sustainable and meaningful employment for the prime age employment gap. And those are the individuals between 25 and 54 that have really completely dropped out of the workforce. They're no longer even unemployed, they're just unemployed, not even actively looking for work. And so that's the whole point, to try to get them back to gainful employment.
I think if you rewind and look at our EDA application, if we didn't have someone of Will's expertise and caliber with us along the application process, we would have probably applied, but probably never would have got to the finish line.
When I found out that we were awarded that $40 million and that everything that we had talked about, everything that we have designed, we actually now had to start implementing. And so that was really one of the most challenging parts of the entire process, but in a good way, because I'm super excited about implementing this project over the next 5 years.
One of the biggest employers in our region is the healthcare industry, and so that's where we really first set our sights with Pikeville Medical Center, with the Appalachian Regional Healthcare, to help facilitate the growth of the healthcare industry in Eastern Kentucky.
Healthcare in Eastern Kentucky has emerged as the #1 industry. Pikeville Medical Center employs over 3,000 people, from physicians, nurses, techs, administrative staff, and support personnel. So when the EDA grant came about, it was a perfect partnership with SOAR, and that really allowed us to widen our scope and letting people know about these wonderful career opportunities and areas of growth that are available here at Pikeville Medical Center.
The workforce that we're trying to develop in the area are people who may not have that patient care experience. We're trying to grow you into a patient care position. We have multiple tech jobs that just require high school diploma, and we'll take care of the rest. So what I think is important about this is that we're doing a twofold thing. We're providing great healthcare to the people of the region, and we're providing great jobs to the people of our region.
I think the impact of PMC being committed to developing workers is priceless and kind of hard to quantify or explain, because anytime that you talk to someone on the street, it's, oh, people are always leaving here. No one wants to stay here. My high schooler wants to go away for college, and you hear parents who are concerned about that. But I think having a lot more opportunities where people can make a well-supporting, family-supporting living wage at a new job is really important, and that's why the career progression is important too, because you can start out in one of our training programs and work your way up to your RN or BSN if you want to, your Bachelor of Science in Nursing. Really, the potential is limitless. I think choices feel limited around here, and that's a result of a lot of factors that we could talk about for a long time, but they don't have to stay that way. And I think that the work we're doing here has a great impact on that, and will continue to for years to come.
My name is Deanna Mullins. I'm from here from Pike County, born and raised, and I'm a medical assistant on Clinic 8. Well, before this, I was working at Thacker Memorial, being a funeral director and embalmer. It got to be really hard with my family and stuff, being on call. I needed something with a schedule, especially with having 3 kids. I saw the job opening on Indeed, because I was actually job hunting at the time. And I thought, I can't do that, that's too hard. So I was like, why not? We'll give it a try, and loved it. Loved going to school, learning to do the books, and learn about the medication and stuff. The more I done it, the more I actually enjoyed it. I'm in rheumatology, so every day is a new experience. You learn something new. I never would have dreamed working here. I bet I've drove by this hospital 100 times. Never thought once about working here, but once I am here, I mean, I love it. It's long days, it's long hours, but I love being here. I actually enjoy getting up in the morning once I get going. I honestly don't see myself living anywhere else. These mountains are home. My husband, he works in the mines. My papa worked in the mines. I mean, it's tradition, and the kids, they ask every day what I do. And I feel, my oldest one, Brooke, she thinks that's real cool that I could give shots all day long. And she wants to do that too, and I'm like, well, we'll see and stuff. And she's really talking about going into nursing and stuff when she goes to high school and, you know, graduating. And I told her that'd be a great career for her and a great career choice. And here, you know, I'm actually saving lives. I'm making a difference. I would like to further my career at PMC, probably be an LPN, maybe a nurse. We'll see what the future holds, who knows?
Obviously, in doing the grant, we knew that it was focused on employment and job growth and training. But as we were talking to a number of businesses during the application process, they all talked about 3 of the biggest barriers to employment, that being transportation, housing, and childcare, with childcare always coming out on top.
There's been a lot of attention on childcare, especially in the state, since COVID and the closure of a large percentage of childcare in the state. We were already a childcare desert in our region, which just means that we have more children waiting for childcare slots than we have slots available, at a ratio of about 3 to 1. Center-based childcare doesn't necessarily work in our region as a business model, and that's where the Appalachian Early Childcare Network comes in. We helped found that organization. We have several of our staff members that serve on that board. So I think this grant is really capitalizing on the work that has already been put in. And then now that that work is growing, is an opportunity to really help it flourish and to expand.
Pretty much as soon as I was hired, as I said, I started during COVID, and we looked at the decrease in family child care homes within the past 20-ish years. Had gone from, we were down to like 200 from a high of maybe 1,200. So many people found out that child care it wasn't just a luxury, it was a need. And so our people that had to work during COVID, they didn't have any place to take their children. We had a lot of bipartisan support as well, which was wonderful. In Frankfort, when we go advocate there, they're really much saying, what can we do? What can we do to bring child care back to the area? Family child care homes make so much more sense, and because of our geography, for one reason, and because our parents, who typically may not have high-paying jobs, them having to drive to the a larger town to take their kids to childcare, they don't come out ahead. They're not making any money. So we looked at opening family childcare homes, and we cover 46 counties in Kentucky in the Appalachian region, and we help them through the whole process of starting their own family childcare home, technical assistance, free training, make sure that they have everything that they need to keep that business successful. And it's generally women that open these businesses. We want them to see themselves as a business owner, so that's something we're really emphasizing, and we want to empower them. And so I think we're seeing more of that as we move forward. You're not just a babysitter, you're actually a teacher, you're a business owner, you're these things.
So my name is Tanya Daniels, and I'm the owner and operator of the Tot Spot in Corbin. We've been here forever. This is my hometown, and before this, believe it or not, I bartended. Bartender makes it sound super glamorous, but behind the scenes of bartending, we also have 4 foster children, 2 adopted children. I have 2 children of my own, so like kids have always been the background of my everything. And we talked one night, literally we talked one night about doing a daycare. My mother was in daycare for almost 40 years, and I talked about maybe that's something that I would be interested in doing. And I feel like we just sort of made the right call, because things just sort of snowballed and one thing led to another, and I was involved in it. I tried a couple of times on my own and just didn't know where to go, where to reach. Then my mother said that there's a group of ladies that you can speak to, and I was like, a group of ladies? And she said, let me see if I still have numbers, let me see what I can do. And my mother, Mom texted me and said, you're gonna get a phone call from a lady named Tanya. And my name's Tanya. I thought we're off to a good start. Tanyas are great. And then I got a call from Tanya, and I was introduced to this whole, early childhood, all these girls, all these women, like Team Me women, And within just a few weeks, I had already met a handful of them. They've already come out to the house. I already had emails with printouts and all these things, lists and binders, and these were the girls. And that's how I got started. My parents are so fantastic. They know that they can't do anything without me. Like we are the ones holding it down so that they can go out and make money and do what they have to do in their household. They know that providing for me and my household allows them to provide for their household. A lot of them are in the medical fields.
We're looking at really pushing this idea of you can become a business owner. So we're going to go out into the communities. We're going to we're looking at getting local leaders to support us, advocating and saying this is the work we're doing, and we can help you economically in your community, because if we have childcare, you're going to have more people that can be in the workforce.
It's not babysitting. It is not babysitting. It's actually very condescending to call it babysitting. I feel 100% like a teacher, So I needed these girls to teach me that. I needed to know the difference in babysitting for 2 hours a day versus getting these children ready for school. I'm taking care of these babies and making a difference. And I'm doing it in the bluegrass. And not to say that nobody else struggles, because I know every area has their struggles, but this is a very poor area. Just since I've been home, this place has changed, dramatically changed. I think with the more businesses and the more growth and the bigger and better this town gets, the more important it is for everyone to do what I'm doing, because I have a waiting list. I have mommies and daddies waiting to get their babies in here because there's not enough Tanyas to go around. There could never be enough Tanyas to go around.
I've done economic development work in a lot of different places, but this work that I'm doing here in Eastern Kentucky, it really means the world to me. I mean, there's no other place that I would want to do this type of work than the hills, the hollers of Eastern Kentucky. And so while I've worked other places, I've always in the back of my mind thought about how I could implement what I'm doing in those other places back in Eastern Kentucky. So, like I said, like this work, it means everything to me.
It can get overwhelming, right? Like when the need is so great. I struggled with that when I started, right? It's like, where do you start? And then you kind of swing and you're like, well, I have to think really big, and we have to think these big things that, can solve this big problem overnight, right? I'm just generalizing. And then you get into it a little bit more, and as you realize, you just got to help one person at a time. You got to help the person right in front of you, and that's the only, whether you've got 10,000 people to help, 100, doesn't matter what the number is. You're only going to get there one person at a time. And I think that no matter what we do at SOAR, while we understand the size of the challenges our region faces, that doesn't change for the fact that change literally happens one place, one person, one community at a time.
This was a region built on the hands and the hearts and the minds of people that went in deep into the mountains every night, and they picked the coal out of the mountains, and it fueled this country's industrial revolution. That's not something to take lightly. The flip side of that is that same ingenuity and grit and work ethic is still here in Eastern Kentucky. We just have to harness it where it's applicable to the economy of today and tomorrow. And I think that's really what the ERC Fellowship is allowing us to dream bigger and reach higher, to look at things with a different perspective and a different lens. And I think we're going to reap the benefits long term and short term as well.